Today's session will be entitled What If It Was Me, and it will target or tackle empathy in medicine and empathy towards patients in medicine. So we're gonna skip the video for now, but I will leave the link in the comments. So if anyone wishes to see it afterwards, you can see it. So what is empathy in general? Empathy is the ability to understand and to share other people's feelings. So what does it mean? It means that when someone tells me how they feel, I can truly resonate with that. I can truly deeply feel what they're feeling and understand what they are going through. So this is generally a very deep and broadened definition of empathy. And they have divided it into different components. The behavioral components, which is how do I show in my behavior that I am empathetic towards you. The emotive and the cognitive, which are defined as the professional aspects of empathy in general and how the expertise show their empathy in clinical work, and the moral one, which is more of a fourth and the social component of why we feel empathy in general. These are the components of empathy in general, but the definitions are targeted towards clinical empathy in specific. Why do we have to define empathy, and what is empathy and what is sympathy? So empathy is not sympathy, and a lot of people tend to really have a problem differentiating between the two. So I'm going to give a very short definition and a very short example. Sympathy is feeling for someone, while empathy involves feelings with them. So what is the difference for feeling for someone and feeling with someone? So let's take the example of a homeless man. If I see a homeless man on the street and I feel, or what I say to myself is, I'm sorry for the situation he lives in. I'm sorry that he doesn't have a house. This is feeling sympathy. So I'm really sad because he lives in this condition, but I'm not resonating with what he is feeling exactly. While if I see a homeless man and I speak with him and he turns out to be lonely, and I feel his feelings. So I'm sorry because you feel lonely. I feel that living without a house or a connection makes you feel lonely. This is more of towards empathy. So empathy is a feeling, while sympathy goes towards a situation or a situation, a specific situation. So why are some people more empathetic than others? And because empathy is this very deep and broad feeling, a lot of studies and scientists wanted to understand it more. So we found a lot of studies about empathy, and one of them being dictated genetic study about empathy. And scientists found that 10% of the variations of empathy between people are due to genetics. So we have a genetic encodings for the levels of empathy that we feel. So this is why some people are more empathetic than others. But it's not the only component, because another study found that women tend to be more empathetic than men. And while looking at the genetics component, they found that it's not in the genes, it's more towards the socialization and education. So women are more empathetic because they are raised in a way that makes them feel always responsible for others, caring for others, and they have the difference in the hormonal and non-genetic biological differences between men and women. So we found that one, genes are part of our levels of empathy. Two, our gender or the fact of how did we socialize and how were we educated. And third, the likelihood or the correlation between empathy and disorders or spectrum disorders in humans. They found that autistic people that has lower social connections have low empathy related genetic variations. So they are their genomes encode for lower empathy levels. This is just to tell you that empathy is has a biological component and has a genetic component in it. But it does not mean that I cannot become more empathetic. So studies found that although empathy is encoded in our genes, and although our biological and situation codes for empathy, but it can be a learned behavior. So if I am born with a low encodement of empathy, or my genome doesn't encode for a high empathy levels, I can train myself to be more empathetic. And they found that although empathy is an innate capacity, but when ladies who had newborns embedded their learning strategies towards telling their newborns how they're feeling and just encouraging them to express what are they feeling, they turn to be more empathetic. So this to conclude that the study said because these newborns, when they were taught what feelings are, how you feel sad, how you feel happy, how you can express your emotions, they tend to be more empathetic because they have their own emotional intelligence. So your ability, everyone's ability to feel their feelings, to know what are they experiencing exactly and be able to labelize them, will help them to understand other people's feelings. So if I understand me, I can understand you in a very short and directed way. What is clinical empathy, on the other hand? And this is the subject of our session today. So clinical empathy is directly correlated between physicians and patients, or healthcare professionals and patients. And it's the ability to connect and to understand what my patient is experiencing. So I can identify, I can isolate it, I can withhold my own reaction, but I understand what my patient is feeling. So the difference between empathy in general and clinical empathy is that when I empathize with a friend, I can cry with them. So if they're crying, I can cry with them. But in clinical empathy, I understand that they're sad. I know why they're sad, and I can help them feel less sad without implicating my feeling, without starting to crying, for example. So this is the fine line difference between clinical empathy and empathy in general. Why is clinical empathy important? Some studies were really working on, they divided like physicians, empathetic versus non-empathetic, or more empathetic versus less empathetic physicians, with the patient's outcome, satisfaction, communication status, etc. And they found, they have summarized it with the following chart. So what does this chart say? It is divided into 4 quadrants with caring and competence. So they found that the physician that is highly caring, even if they have low competency levels, they were affectionated by the physicians. So patients. So patients did not tend to treat them badly or yell at them or try to sue them, etc., because they are less competent. لأنه their caring level and their empathy level were just covering it up, because they were trusted by the patient, they were respected by the patient in a way. The highest level of communication and trust, which is like the utmost feeling that someone can feel to their physician, was with the high competencies and high caring levels. While low caring level with high competency, I respect my physician, but I cannot connect with them. And low, of course, they were like disruptive. So how to turn it into a very smooth and very like easy conversation? Basically, empathy in clinical fashion has increased, is highly effective and is highly powerful because it was correlated with building patient's trust. It's very important between a patient and physician relationship. It calms the anxiety of the patients and they felt more understood. It improves the health outcomes of the patients because it showed a very strict behavior from the patient. So when the physician was telling them to take a medication, they were really abiding by the physician's instructions, associated with better adherence to medications, as we said, decreased malpractice cases and decreased lawsuits against physicians in general, fewer mistakes from the physician's side, and it increases the patient's satisfactory level. So they were more satisfied from the whole process in general. So this is why it's really important, and we're not like just telling people, learn how to communicate with their patient, with your patient, and just explain to them the situation. It's like a very more deeper connection. Yet, although it's this important, we found that doctors lack a lot of clinical empathy, and these are like very, very recent studies. So what influences this relationship? So what do doctors learn, or how are they trained to lose their empathy? So they found that the education in general, and mainly these factors, influenced this. the high number of patients that professionals have to manage, and the huge load of paperwork, the lack of adequate time. So basically, we train residents in very long working hours without the tendency to take breaks, without tendency to have the adequate time to spend with their patients. We focus a lot on the therapy in our academic culture and not the humanitarian basis. So basically, what we learn in medical school is a disease and the treatment, a disease and the treatment. We did not learn how to treat a human being, which is totally different. And the lack of education and empathy itself. So we're not trained to feel empathetic. So let's dive deeper into this topic, empathy and medical education. What decreased empathy in the study in the medical education years? So a study found that medical students are less empathetic throughout their undergrad, grad, and post-graduation years. So they are like scaling, whenever you are going up in your years of training, you are being less empathetic. So why? First of all, we have the traditional and dictating teaching methods that are more based on competitive skills that we have to acquire, and just letting our peers like have lower grades than us. We have to have the better grades. We have to know everything other people don't know, etc. We have hidden curriculums, and we have the lack of role models. So basically, in the new era of medicine, physicians are becoming less empathetic because they were trained with the same curriculum, and we are learning from these people. So it's like a chain that is always ongoing. Institutional culture, and basically in a lot of countries, and in Lebanon especially, we learned that the physician is a higher image in the society, and whatever the physician wants he can get, and patients are lower in like the case between like the relationship between physician and patient is not on an equal or equivocal basis. It's like higher and lower cases. So generally speaking, the greater focus on technology rather than humanitarian aspects of medicine, which is really very disturbing, because lately we've been learning about robotic laparoscopic surgeries. We've learned about a lot of stuff in our curriculum, but we never had the session that tells us how to communicate with patients and how to feel more empathetic, or just that tells us how can we understand what we are feeling. Because if we can go back to the definition, what we said previously is that if I understand what I'm feeling, I can understand what other people are feeling. But our curricula, the way it is built, it doesn't leave time for us to understand us. So we are able to understand what our patients are feeling. Increase students and residents number in general. So this contributed to the lack of focus on the students and on the residents' general formation, so that all the residents and students have like acquired the same knowledge, but they are not exposed as previously, and they are not followed as previously because they are like a huge number. The lack of resources, especially in empathy, because we're going to discuss later on how can we teach medical students to feel more empathetic, and these resources are not present in most of the universities. The emphasis on research. So basically, we are always encouraging medical students to go to research, or residents to go to research, and we are just pressuring them with the whole load in the hospital and the whole load on research. I'm just trying to be a leading research institute, but we're not working on other points in the curricula that we're going to discuss later on. The practice of managed care and defensive medicine. So basically, this is really true. The last few years, we had emergent an increase in the lawsuit case against physicians. And the training of physicians became that you have to follow the guidelines, because anything that you do wrong, they will suit you. But it didn't become that you have to follow your patient, you have to communicate with your patient, you have to create a very good connection with your patients so they do not sue you, which is really something that research has found. So we know that if we're more empathetic, we know that if we created a connection with our patients, we would do less mistakes. Personally, we would do less mistakes, but we're not following this. We're just trying to be more systematic and more like following the defensive care measures. So these all things that we listed are just trying to show out the case of what is medical education doing wrong. But how can medical education do it right? So can we learn empathy in medical school? So what we said before is that on a personal level, yes, you can learn empathy. You can become more empathetic because it's a learned behavior. You can just train yourself to be more empathetic. How to do it in medical school? It has to be something on a larger scale, and it has to be something correlated with the general education. It's not personalized. So studies also worked on this, and they found that yes, if we follow something that we call a systematic training of humanistic qualities, residents and medical students will become more empathetic. So what does this mean? So basically, it means that we integrate something that we call narrative and creative medicine into the curriculum. So it's not about only studying diseases and medications and just rotating in hospitals. It has to do more with the narrative part of medicine. What does it mean? It means that we have to make medical students write and learn how to write reflective essays. So, for example, if a student went to the hospital and had a very bad day, he can write a reflective essay about it, just try to understand what he felt, why he felt this way, etc. Because learning how to embrace our emotions will make us more empathetic. Writing in general, it can be journaling, it can be writing a narrative article, it can be anything that can help also like widening the emotional and narrative aspect of the students in the curricula of blogging in general. So just like trying to tell people what happened during the day, or just like trying to integrate it in school. Drama, so basically drama classes make us like we learn how to just if we can say like fabricate a feeling or an emotion. So just we can try to act sad, act happy, act joyful, etc. This will make us learn how we feel, what we do when we're sad, what we do when we're happy, what we do when we feel joy. And this will make us more able to understand our feelings. Poetry in general, fiction and films also in general, and etc. We have like studies that spoke about museum visits, about just the work of arts in general, etc. So these all can help medical students become more empathetic. So what should you do? So basically now we know that our universities want to change the curricula tomorrow, and we know that this the creation of these bonds will really help us in our career. So can I work on something on a personal level? Yes, of course you can. You have to just say that I want to show empathy. I want to learn how to show empathy. And it's not easy. So just saying these words will seem that are like very easy and you can implement them in your life like very, very easily. But on a real life and in a real scale, they are very hard. So you have to decide to connect with empathy. You have every single time that you're having a communication with them, a conversation with someone, you have to decide to focus on their feelings and to understand how can you help them in this situation. You have also to convey the listening intentionally. So I want to listen to you. I want to listen of what you're saying, and I want to understand your feelings. I want to listen to you, what you're saying on the surface, and I want to understand what you're feeling, what are your needs, what are your values, deep down. We have to remain present. So when someone is speaking, and basically in the physician conversation with the patients, it's really short. It's about a 20 minutes period of time that you have to gather all the information, and you basically are to try to understand what your patient is saying in general. Okay, so you have to consider to respond verbally. So basically, not responding with nodding your head or clapping, etc. Just because when you respond verbally to someone, they know that you've been listening and you understood what they were saying. And also, you can help yourself to understand better. We're gonna say how. You have to look for cues in the speakers, every single thing said throughout the conversation and with the patient, and you try to show empathy you have to just reflect on the experience that you had. So were you empathetic? Did you show empathy? What can you work on to just modify this behavior and make it better? And this will help you to offer more empathy the next time. So generally, it's just an assessment of what you did. To just make it like simpler and to just make it more effective and something that you can do in your daily lives and your routines, we're just gonna speak about effective communication. So effective communication is one key component of every single relationship that you will build, especially with your patients. And it's a skill that is really, really useful generally and in showing empathy in specific. So we're gonna just focus on three components in effective communications that are summarizing, paraphrasing, and empathetic responding. Just a definition of everything. Summarizing is the fact that I just repeat what the other person said while highlighting the very important piece of information. So for example, my patient said that she's a 34-year-old suffering from 1, 2, 3, 4, and she came today for a general checkup. So I can repeat. So if I understood you right, you said that you come to my clinic today because you have these all comorbidities and you want a general checkup, for example. So this is just to say that I understood what you said. I was listening to what you said, but I want you to confirm if I understood right, or just to sum up the conversation in general. Next, we have the paraphrasing, which is repeating what the person said, but the way that I understood it. So just using other words. We're going to take an example. So, for example, someone said, I'm so glad that I moved into the retirement village. Every day there's something new to do. There are always a lot of things going on. I'm never bored. What you can say as a paraphrase is, so there are a lot of activities to choose from. So this is what he said basically, but in different words. And this shows that I understood what the person is saying. But this is not adding anything from my own imagination of what I felt. It's just what he said, but in other words. While empathetic answering is telling the person what he is truly feeling behind this communication, behind this conversation. So if we take the same example, I'm so glad I moved to the retirement village, I could say, you seem to be loving living there, because this is what he's trying to say. He's trying to say that I moved to a place where I can enjoy myself, I can do everyday's activity, etc. So this is an empathetic answer. I told the person that I understood your feelings. I understood what are you feeling now exactly. Okay, these are components of effective communication that you can always train yourself to do, and they will really become very helpful in your practice. So if we can try to sum up what we said, it's about treating your patient the way you would want your family member to be treated and you want yourself to be treated. So if you went to a physician and said anything, you just really want to be understood. You just really want to be heard, and your dad, your mom, your cousins, anyone from your family, someone that is really a loved one, for example, you would want them to be treated this way. You would want them to be listened to. So just do this for your patients. Always treat them as if they are connected to you. But here comes a fine line that we want to discuss last, and that is really interesting in general in empathy and healthcare, is that a fine line between being very empathetic and really caring for our patient and burnout and compassion fatigue exists. So what is burnout in general? Studies found actually that if you have empathy, it is in an inverse relationship with burnout. So the more you are empathetic, the more you are burned out, the less you are empathetic. So there is a negative association between them. So to keep your empathy, you have to be less burned out. You have to be away from burnout. And burnout is the fact where we can feel emotionally exhausted, not connected to our job, doing our job without satisfaction, and just without doing them the way we used to do them, with the expertise and that we put later on, the depersonalization that we can feel in our job, the emotional exhaustion, etc. So when we become burned out, we would be less empathetic with our patients. The higher burnout levels, the lower empathy level. Compassion fatigue, on the other hand, comes from a lot of empathy. So basically, while burnout is negatively associated with empathy, compassion fatigue is defined as a secondary traumatic stress disorder. So basically, it's the fact that I care for a lot of people, I listen to them, I empathize with them, I feel their feelings to an extent that I can become traumatized from their traumas. So their traumas become my traumas and I start to live with them. So this is connected to empathy in a totally different way than burnout is. So basically, the more you're empathetic without learning to set your boundaries, the more you are at risk of compassion fatigue. What are the symptoms of compassion fatigue? Irritability and frustration all the time, feeling of restlessness, sadness, feeling that you are not able to help other people, just being isolated from other people because you do not want to feel relied on or help other people, absorbing other people's traumas as yours. This is like the main symptom of compassion fatigue. How can you prevent compassion fatigue and burnout in general, or anything that might disturb your equilibrium in general, is by putting yourself first. So you have to learn always that if you did not take care of yourself, no one would ever take care of you, and you won't be able to take care of other people. So there are saying that says you can't pour from an empty glass. You can't do something for other people that you do not